Good morning and thank you for joining us on Daybreak. My name is Lillian Muli and our topic of conversation this morning is on immunizations, which are crucial for public health in Kenya because they help prevent I beg your pardon, let me just take that by you again. They help prevent the spread of infectious diseases and protect individuals, especially children, from serious illnesses. On the show this morning, our guests in studio will help raise awareness on the importance of immunization. And I'm joined this morning by Dr. Abdirahman Farah. He's a consultant pediatrician. I'm also joined by Caroline Mololo. She's a nurse and a midwife and technical officer, Midwife Association of Kenya. Many thanks for joining us this morning. Dr. I'll start with you. Kindly give us an overview of immunization in the country. Where are we at? Are we on the right path?
Good morning, Lillian. Thank you so much for having me today. We have definitely come from far. We are doing much better than before. We are now doing in upwards of 70% coverage. I think we are on the right track. We still have a lot of things to do along the way. And I think today, more than before, a lot of people have realized the importance of vaccinations for the health of a child. So I think we're doing better.
Yeah, in terms of the significance of immunization as regards public health, you say that people are more receptive towards immunization now. So in terms of public health and the significance of immunization, when you say that we are at 70% now, what is that?
Well, first of all, immunizations, I mean, why do we do immunization? We do immunization to prevent children from getting serious illnesses that result from infections. So as time goes by, people realize, and of course as our people get more educated and our society gets more informed, we realize today it's more important to prevent disease from happening than curing diseases, which are costly over time. So I think the general understanding is better now. We have more people who understand the importance of immunization, and I think we're doing better.
And Caroline, in terms of the recommended vaccinations for children from when they are born, just give us an overview from when a child is born, right from birth up to, I believe, 10 years or thereabout. What are the recommended vaccinations?
All right, so good morning, and thank you, Lillian. Thank you, Doc. I'm glad to be here. So we have several immunizations which are there. We have the KP vaccines, which came about from the Kenya Expanded Program of Immunization. This, I would say, came about from the 1980 because their main aim was to fight the big five, the big six actually, which are causing death to children before the year one. That is tuberculosis, polio, of course, diphtheria, whooping cough, tetanus, and many other diseases. So what happens is the Kenyan government the Kenyan Ministry of Health came up with a program to have babies vaccinated from birth. And so from the time the baby is born, that is at 0, we normally give BCG, which is a vaccine we give to prevent tuberculosis, and a dose of polio. We call it polio 0. Then after, right now we're also giving vitamins to the babies and hepatitis B, which is very important because babies are prone to hepatitis due to the birthing process. Now, at 6 weeks, we normally give the children the first pentavalent vaccine. Pentavalent is a combination of 5 vaccines. That is DPT, diphtheria, pertussis, and tetanus. And then we have, pertussis is whooping cough, and then hepatitis B and Haemophilus influenza type B, which is known to cause a lot of pneumonia and meningitis. Then, of course, we normally give an pneumococcal vaccine as well. Polio is also given the first dose. Now, this is repeated at 10 weeks and at 14 weeks. Then the baby goes into what I can call a rest period. Then at 6 months, we are back. We give vitamin A, 100,000 international units, which is given to the baby. Vitamin A is known to help with immunity of the baby, as well as reduce the issues of blindness, because that is what causes a lot of blindness to children below 1 year.
Yeah.
Yeah, so and any disease, protect the baby from any other diseases like measles. Now, if a baby is compromised, probably had HIV, then this is the time also to give measles injection.
Yeah.
But if the baby's injection will give at 9 months. Then come to 9 months, we normally give measles injection, which is given at the deltoid or the upper arm. And this is to prevent the babies from getting measles. Again, remember, this was one of the big 6, which were causing death to the children below 1 year. Then at 1 year, we normally give now 200,000 international units of vitamin A. And then the babies, all through, we are doing weight checking and monitoring. At 1 year and a half, we normally give a repeat of measles, a booster, which now we add rubella. So measles and rubella. Now, these are the KP or Kenya vaccines, but we also have other vaccines in between, which are called baby-friendly, which are seasonal, which we give especially to endemic areas, like now yellow fever. We normally give it at 9 months, especially to areas that are endemic to yellow fever. And then also we give malaria. Currently, we are also giving malaria. Yes, so especially to the endemic areas.
Right, thanks for that overview. Daktari, have these vaccinations been efficient in completely eradicating some of these infectious diseases? Say, we're talking about mumps, measles, and whooping cough, and even when we now move over to polio and smallpox, can we say that these vaccines have completely eradicated some of these diseases?
We are not yet completely there. The efforts are there. We're putting in efforts to try to cover as many people as possible. We cannot say we have eradicated all of them. We have tried that in the past, but this, we are a country where we have, we interact with other people from all over the world. If we try to do, let's say we try to eradicate, a microbiome from, this country, we'll still have visitors come from elsewhere who reintroduce those, bugs into our system. So I think efforts are there. We are heading there, but we have not reached a time when we can say we have completely eradicated measles. We often have, from time to time, we have sporadic cases. So we are not yet completely there.
And Caroline spoke about immunocompromised babies, but what about the preterm ones and the low-weight ones? Are they also eligible for vaccines? And how then do you weigh whether or not to give them these vaccines and at what point?
Well, preterms need to reach certain weight before they get, before we start vaccinations, because we believe the immunity is quite weak and they might not respond quite well to the vaccine. But immunocompromised children, there are certain vaccines we give them, certain vaccines we avoid because of the likelihood of getting an infection from that vaccine.
Okay, Caroline?
Maybe I can add on that. Yeah, I agree with what Doc is saying. And what we normally make sure is that on discharge, any preterm baby gets to get the vaccine. Now, for the babies who are born, for example, at home, the first contact you get to have with them, then you give them the vaccines. The other thing is, as Daktari has said, for the very immunocompromised, the ones who are having, the disease process, then you cannot give them live vaccines because you're introducing a bacteria or a virus into the body which is already compromised. Yeah, so these ones may have to wait until
Okay, so when you say live vaccines, because you're coming from a medical point of view, to our viewer, what is a live vaccine?
All right, so we have different kind of vaccines which are available. We have live vaccines, which are you're introducing a bacteria or a virus that has been weakened. So it cannot cause a disease, but it can replicate so that it produces antibodies into the system. And so once the system has already formed antibodies, anytime they meet that disease, they're ready, they remember. There's a memory cell that is there to remember that this is a disease, I need to fight it. Then we have inactivated, Now the inactivated are either, most of the time you'll find the genetic material is what has been removed, either through heat or radiation, or chemicals. So again, it will help with the immunity, but it will not be as live as the ones which you introducing the live bacteria or virus into the body. Yes.
And Dr. you had talked about an increase in intake as regards vaccines. So in terms of some of the misconceptions and concerns that you've encountered, or rather the medical field in the country has encountered as regards concerns around immunization and low uptake, what are some of those?
Well, I think as we get more informed as a society, we tend to develop, or perhaps we tend to create misconceptions about things that are usually the right thing. What is happening now, we're in an age where there is a lot of falsehood that spread about vaccinations from people with certain interests. The common ones is the association of certain vaccinations with certain illnesses. That has, the most famous, issue is the issue of autism and measles. That has been propagated for a long time, and there's never been a very strong evidence to associate the two.
Yeah.
So that is one of the things that we come across. The other thing is that, based on where people come from, yes. Certain people hold certain religious or cultural views, towards vaccinations. In some cultures, you find people saying no to all vaccinations. Certain people with certain, information or education tend to do, certain vaccinations and leave out others. So we have all those challenges, but I think overall, there is a positive, thinking towards vaccination.
Yeah.
And as people see, we have had situations where there were, like the story of COVID, where there was widespread, infection, and there was death related to it. When vaccinations came up and people who were vaccinated, people started thinking about it. They thought, okay, now this is the only way we can stay alive, if we get vaccinated.
Yeah.
So that, in a way, has contributed to the current, thinking towards vaccination.
Caroline, are there specific reasons or regions that are vaccine averse where you find that there's a general perspective or perception towards immunization and vaccination?
Yeah, what I would say is that, of course, you will find, as Doc has said, there are several regions where you will find an issue in regards to vaccination. And like polio, there are times we have to do a repeated dose, because we want to do either mass coverage or because there was an outbreak of the polio. And so whether there's a different strain, remember viruses replicate. Yeah. So whether there's a different virus that has come in, then we need to vaccinate. Now, when you go to certain places, you will be told, my baby already got polio. Why are you giving another polio? Same to measles. You'll find that when there's an outbreak for measles, we have to jab, we have to do a mass coverage. Yeah, so there are regions where you will go, of course, I won't mention probably specific areas, but you will find, because of tradition and culture, people tend to not to go to the clinic. Remember also, if the clinic is very far. Yeah. And that's why we try and do door-to-door. Right now, you'll find that people are doing door-to-door immunization so that we have a mass coverage and make sure that all our babies are getting immunization. Yeah, but otherwise, the challenge is still there, as Doc says. I cannot say we have reached 100%. Yes, the culture is there. Sometimes even church comes in, especially when you have to do a second or a third round of vaccination. And you can hear that maybe this is going to cause infertility. Then people become scared of getting vaccines. Yes.
And do you feel, in your opinion, Dr. that the government has done enough to increase awareness around public health, immunization, and the importance, particularly in regions where it is believed that there are common perceptions we had during the COVID pandemic, that there were regions where people were completely averse to the vaccine. So in terms of engagement of communities, involvement of community leaders, community engagement, do you feel that the government or relevant bodies have done enough to increase awareness?
Well, you can never say we have done enough. Everything is done in a more gradual way. I think government is doing its bit, But I think, as you've mentioned, there are a lot of stakeholders in this. We are part of that. The community leaders are part of that. The religious. She talked about religious, people, sometimes going against vaccination campaigns. Well, all these things. I mean, we need to put all these efforts together so that we have a common ground. And I think as time goes by, definitely these things will change. Opinions will change. It's better now than before, and I see a lot of hope, in the future.
Yeah. What more can be done, Caroline? And where is the gap? Where does the gap lie?
I believe education and sensitization is very important, because once you sensitize a mother, you sensitize a community, you sensitize the whole, community. It's important as the women come to the clinic, you tell them about it. The other thing is discussing side effects of the vaccines, because you realize if you don't discuss the side effects, once the woman goes with the baby at home and the baby starts reacting in a certain way, they will say it is the vaccine that made the baby to become sick. So as healthcare providers, we are also called to tell the clients that this is what you anticipate once you get this vaccine. I believe also just talking about it, let them also talk about it, involving the male partners. Because most of the time it is the women who carry the babies to the clinic. So the male gender is not available. So make sure even the male partners are being involved, the parents are being involved. That will capture the whole community. And of course, just community awareness. Going to the community, going to the grounds, talking to them, let them ask questions and we can address them. Yes.
And if you could pick out, Daktari, a specific campaign that has been effective in terms of increasing awareness and uptake of vaccines in the country, regionally, nationwide, which would you say has been the most effective in terms of uptake?
Well, campaigns happen quite often. There is one going on now. I don't know if you're aware. There's cholera campaign that's ongoing now. I personally receive messages every day about that. So I think there's a lot that it needs to be done, definitely. We need to, we might not reach government, might not reach everybody, but I think there's a lot that has been done, and I think there's a lot that's been done now. Recently, we had measles. Before that, I think there was polio. We don't have the exact data on what has been achieved, but what I know is that government does a lot. There are TV, promotions, there are messages written, talk shows done on this. I think most of these campaigns do a lot of good things. I don't have specific data on which one, achieved efficacy. But I think there's a lot of work that's been done.
On the same?
I would agree with that. And like recently also a malaria vaccine, which was not there currently. And I was in Homa Bay recently in Vihiga, and you can see everywhere the charts are there. They're teaching the mothers why it's important for the babies to get malaria vaccine, because those are endemic areas. And the fact that the babies have been getting sick, you don't want to lose your baby before 5 years. So if you can do anything to prevent that, then you would go for that. I know there are several facilities right now. What they do is send messages, return back messages. So you're told, remember, in the next 2 days, you're supposed to be coming back to the clinic.
And now we're talking about a regional perspective as regards immunization and uptake, but are these vaccines actually available? When we talk about, referral hospitals, when we talk about far-flung hospitals in the farthest parts of this country, we know that there are places in this country that have been known to suffer in terms of uptake because the availability is wanting or is lacking. What do we know about the numbers? Do we know about whether or not some of these regions experience low uptake because there's actually lack of availability or lack of access to the vaccine?
That has been there all this time. It's always there. We cannot reach every part of this country. But I want to believe that everywhere in this country there is a small clinic, there's a dispensary, and I believe most people are able to access vaccination. Of course, there are certain conditions where it's difficult, where probably when we had drought season recently when people were dispersed, and it was difficult for people to reach health centers. But I want to believe that the majority of Kenyans are able to access vaccination.
Yeah, is access an issue in some of the areas, and would you be able to point out which particular ones would be struggling as regards access?
Okay, yeah, so I think I would agree with what Doc is saying. I know areas which are very far to reach, Turkana, Somali, places in Kenya which are far to reach. Sometimes it's very hard to get the vaccines, especially, remember vaccines have what we call supply chain, and they have to maintain cold chain so that the efficacy is still there.
Yes.
Yeah, so once the transportation also brings an issue, then the vaccine will reach the place, but it will not be potent. So even as they are being transported, they need to maintain the cold chain transportation. Yeah, the other thing I would say is that, especially during the pandemic, during COVID era, because of the lockdowns and everything, there are several places which definitely did not get the vaccines. And women were not also going to the clinics and the hospitals. But right now, I believe most of the areas have a coverage whereby everybody is getting a vaccine. So I believe vaccines are available. It's just making sure that they get to the right places and that they are potent enough to get to the recipients.
Right. Yes. Well said. Dr. Somebody is asking a question here as a pediatrician. He's saying, could you elaborate on the role of parents and caregivers in ensuring that children receive their immunizations on time, and how can they stay informed about vaccine schedules? Because there's also the vaccinating scheduling that, is an issue. So in terms of the role of parents and caregivers in ensuring that children receive their immunizations on time.
Well, first of all, parents need to understand that immunization will save them a lot of headache. It will save them a lot of hospital, visitation. So regarding now, keeping in touch, keeping the vaccination schedule on time. There is a booklet that I think most mothers have, the mother and child booklet. It has the vaccination schedule. It has the timing. It has, when do you need to get certain vaccines? And on top of that, every time you visit a clinic, when you are issued with a vaccine, when you are administered a vaccine, the next return date is written on the side. So that is done to remind you of the next. But I've seen also many institutions do reminders, do send messages to parents to inform them about that. Well, if they want to know about the importance, or the efficacy, or more information about vaccines, they need to discuss that with their primary doctor, or the nurses they interact with often who give them the vaccination.
The risk of not sticking to schedule, if you happen to miss a jab here and there, do you have to revert to the complete beginning?
It's very important to finish according to the schedule. Remember, like polio, we are saying there's polio 0, there's polio 1, polio 2, polio 3. And at 14 weeks, you also give the inactivated polio injection. So if you miss any or you skip any, it means you have not gotten the complete cycle of vaccines. And so if at all you haven't, it is good to start from afresh, so that you can say you have gotten the complete dosage. And so it is important, as Doc says, that the child booklet is always written so that you remind the mother or the client that next week at this time, or in the next 1 month, you're supposed to come back on this date. And as he says, so many facilities right now are sending messages as a return, just to remind the mothers. Because remember, this woman will go home, she's very busy. Sometimes they tend to forget, even us, we forget. But when you get a message, a reminder that Tuesday you're supposed to come back to the clinic, then you start planning for the same. I believe right now, because most vaccines are free, we don't charge. There's no charge that is put to the vaccines. It should be easy for everyone else to go for the vaccine.
There's a concern about the baby-friendly ones being extremely expensive, and a concern about what the difference actually is. So you have the option of going for a free one, and then the elite mom says, no, I would rather take the baby-friendly one, but then again, the expense involved is also a concern for most. Dr. Ari.
Well, the bottom line is to get vaccinated. Get vaccinated as much as you can. If you can't afford the baby-friendly, I mean, you go for it. You can't tell people what clothes to wear or what kind of shoes to wear. People have choices. The difference, not really much. The way they are packaged, it's different. I mean, people, want less painful injections. The baby-friendly ones have a tiny, needles. They're pre-filled. They're already prepared. The risk of getting contamination is low. Some of the vaccinations are a bit different, slightly different, but all of them are the same. I think if you can afford to do the baby-friendly, go for it. If you can't, get the majority of Kenyans are doing the normal vaccines, and they work quite well.
Differences, side effects. Mothers have been known to say that the baby-friendly ones are less headache for new mothers when they take their babies home.
Yeah, it's true. Yeah, it's true. The baby-friendly ones tend to be less painful, to be less of the side effects. But at the same time, it depends on the costing. Yeah, and that's why you'll find there are women who will decide to actually do both. So maybe you will do one, especially the 6-in-1. The pentavalent, that is the one that is normally looked as very painful. Yeah. And that is the one you will find most women will tend to go to the baby-friendly as compared to the KP vaccine. But as Doc says, the most important thing is to make sure the baby gets the vaccine. The side effects are not so must unless the baby gets a reaction, of course, or there's an infection. And we will tell you, in case of a high fever, this is what you need to do. In case there's soreness in that area, there's always we will always give you what to do in case of any reaction. The ones will have maybe an allergic reaction. That means maybe the baby is not breathing well. Then, of course, they need to bring back the baby to the clinic. But otherwise, the debate will always be there. Remember, we have different companies that are making these products. We have GSK, we have Sanofi, we have Pfizer. So everybody will come with a different brand of the same vaccine. So as Doc says, depending on the packaging, depending on how it is pre-filled, there are people who will prefer that. And I mean, if your insurance company is paying for you, you have money, it is okay. Yes.
Dr. as a pediatrician, some of the common conditions that are presented at your clinic or mothers come to you with, and we're talking about this sensitive age from, say, 1 month up to about 10 years old. What are some of the common conditions, just slightly moving away from the immunization conversation, that are presented at your clinic or at the hospital where you work?
Well, the most common presentation is usually an infection, whether it's in the upper airway, whether it's in the chest, whether it's in the tummy. So those are the most common, presentations. Children will present with fever, a cough, runny nose, diarrhea, vomiting. Those are things that we come across quite often. Well, of course, there are other presentations. Children come with seizures. Children come with, chronic conditions. So most common causes definitely infections, and that's why we are emphasizing a lot on vaccinations. Yes. Well, we see a lot of upper airway infections. We see a lot of pneumonias. These are things that can be prevented by vaccinations. There is a misconception that, and I've seen this quite often in my practice. Parents believe once they have been vaccinated, they are less likely to get an infection. That's not true. What vaccination does is to prepare you well so that you can fight off an infection when you encounter an infection. It doesn't mean you're not going to get an infection. You'll definitely get. But when you get an infection while you're vaccinated, you tend to get a milder disease. Don't get very sick. So this is actually where our focus is. Those of us who are practicing children medicine now, our focus is to make sure less children visit the hospital. That's why we discuss things like vaccination. That's why we discuss things like good nutrition, breastfeeding, That's why we discuss things like, nutrition, breastfeeding, vaccination, all those things.
Yeah, and there's been a debate about antibiotic resistance, and this is something we've seen across posters in hospitals. However, there is a general feeling that most pediatricians are too quick to administer antibiotics. Are you of the same opinion? Would that be something that would perhaps be a concern as regards the recurrent infections and the recurrent hospital visits by most parents?
Well, I'm not one of those, and I don't think many of my colleagues do that. What happens is that I don't want to blame anybody, but I think if antibiotics are easy to get in the market, people most often will tend to buy them. Then they come into my office and pay in a consultation, spend a long time, in a queue. Do we agree with? Do we support, use of antibiotics, without any indication? No, we don't. And in fact, that's one of the problems that we are fighting today. One of the problems that we are grappling with is this antibiotic resistance. So we don't give antibiotics unless there's indication. We often try to avoid them. Many of these illnesses that children present to the hospital can go on their own. Yeah. Most of them are caused by viruses. We don't use antibiotics to treat viruses. So that challenge is there, but I think we have definitely a role to play. We have to educate our patients. We have to stop, this behavior. But government also has a role to play by restricting the easy, dispensation of antibiotics at the pharmacies and hospitals.
On the same, Caroline, have you experienced similar situations where there is unnecessary and also the over-counter purchase across chemists and pharmacies in the country? Where do we draw the line as regards who can administer antibiotics to children, to babies? Yeah.
I agree with what Doc is saying, is that it's even before you give an antibiotic, the child has to be tested. Even for yourself, you need to be tested to confirm that you have a bacterial infection. It could be a virus. Now, you can't treat a virus with an any antibacterial drugs. But you will find that because it's something that we discuss, you will find even in groups, someone will say, my baby has this and this. And someone will say, even for me, my baby had this and I gave this. Now, you didn't get a prescription, but you're assuming that that is the same disease that your child could be having. And so you go and buy the same drug. Yeah. As Doc says, we need to have policies in place that restrict the distribution of antibiotics without any consultation. Yeah. Number two, without proper testing, because someone can, even right now, you can just go to any pharmacy and ask for azithromycin and you'll be given. Or you say you have a sore throat and you'll be told take azithromycin. So if we have policies in place, they would help us in regards to the control of dispensing antibiotics.
Yeah, and I'd like us to go back to the challenges that the country has faced in terms of vaccine distribution and misinformation, particularly the misinformation bit, Daktari. A lot of viewers are concerned that they do not have enough information as regards vaccines. Caroline here took us through from 0, I believe, to 9 months, what a baby should be given and how to stick to the schedule and to the calendar, the vaccine calendar. But in terms of misinformation, what are the top concerns that you have in the medical field as regards misinformation in the general public around vaccines and, particularly vaccination of children?
Well, if you look at it, misinformation comes from people with less information. Our patients are seeking information from the wrong people. Many a times, patients come to the practice or to the hospital with a predetermined, opinion or a position. We will say it, reading this information from the internet, talking to other parents who have, who have experienced problems with vaccines, or perhaps who have some idea about vaccines. We definitely have a role as practitioners. We need to give the right information explain things, give evidence. Government does definitely its part. I can't talk for government, but I know government talks. There are always campaigns on the TV, you know, on newspapers regarding vaccinations. The bottom line is this: if you need to know something about vaccination, ask people who know about vaccinations. I mean, talk to the doctors, you know, talk to people who have knowledge on this, and then that will help. You can't stop people from sick. We in the African setting, you know, people talk to each other. People, you know, before they come to see you, they must have talked to a lot of relatives and neighbors and everybody else before they come to you. So when they come into you, they're more likely coming to confirm a theory than perhaps get, you know, the right position or the right information.
Right. And I want to talk about the cholera vaccine and the fact that there's concerns that there's an outbreak in several parts of the country when we talk about certain prisons, certain schools as well, and this being labeled as a mystery disease that nobody has really been able to put a finger on or explain to the public exactly what the genesis is in terms of the vaccination drive that is currently ongoing. Where are we at? And just in terms of sensitizing the public around hygiene, around staying safe, and around the importance of this vaccine for those who have not yet taken it. I'll start with you, Dr. as we go to Caroline.
Well, cholera vaccine is fairly a new vaccine. It's not been there for a long time. Mm-hmm. For those people who take the baby-friendly vaccine, it has been there for some time.
Yeah.
Majority of people do not. I think, and because of course, most of the places where this outbreak is places where the challenge of sanitation, there's lack of, you know, knowledge, mm-hmm. places where there's overcrowding, you know. So cholera vaccine has been there. I'm not sure about the uptake so far, yeah. but there is a current campaign. I think once it's over and we have information about it, we'll be able to comment on how effective and how much, you know, how many people have benefited from it.
Mm-hmm. Caroline,
just adding on the same, as he says, the people who've been getting baby-friendly vaccine, there is what we call Shankol. It is a cholera vaccine which has been given. And it's normally a 2-dose vaccine. Yeah. It's normally given from 1 year, mm-hmm. once the baby clocks 1 year. Yeah. And to any adult, mm-hmm. yeah. Mm-hmm. We also give, especially to people who are working in health sectors, yeah. people who are working in, you know, food industry, then they also need the cholera vaccine because you realize these are the people who are prone to get this cholera. Mm-hmm. As Doc says, sanitation is key. Yeah, infection prevention, how they handle food, how you handle water, how you handle, you know, stool, all that, basically sanitation. Yeah, it just cuts across sanitation.
And we're taking your feedback very shortly as we continue to engage our guests in studio this morning. Remember, we're talking about immunization being crucial for public health in Kenya and talking about why it's important for you as a new mother, as a new father, to adhere to the vaccination schedule of your child. Daktari, just going back to the conversation that we were having around challenges for you in the medical field that you've faced as regards conditions that are presented in your hospital and parents not sticking to their vaccine schedule. Somebody is asking whether you could go through the main you know, some of the risk factors that would be associated with parents not adhering to their vaccine schedule and how then that could display itself as a challenge that could require frequent hospital visits.
Well, vaccination is not like, you know, seeking, going to hospital for a condition. Mm-hmm. It's something it's like a ritual. Yeah. You know, you have to do it at certain times. It's not easy in the urban centers. I mean, it's an urban setting where people have work and you know, making frequent appointments. It's not easy. Yeah. But if you look at the comprehensive, the whole vaccination schedule starts from birth all the way 5 years, 9 years. So it's a bit cumbersome. Yeah. But if a parent is motivated and knows the reason why they're doing this, I think they will be able to. Many people, you know, really, comply. Mm-hmm. Few might miss a vaccine, 1 or 2, because of, their work, situation. Perhaps people far away from health centers might feel it difficult to, travel a long distance to get vaccinated.
Yeah.
So challenges are there. There are few other, situations where people don't, maybe a parent who has had a bad experience with the vaccine, and who, maybe a child got a severe reaction. Or maybe a child got a condition which they associate with the vaccine.
Yeah.
They would be, that parent, if they have many children, they might end up not bringing the other children for vaccination because of their experience. So challenges are there.
Okay, thanks for that, Dr. And Caroline, somebody is asking, is it safe to vaccinate pregnant women, and with what?
Yes. Yeah, so we have different categories of, can I call specialized people who are supposed to also get vaccines. As I mentioned, of course, the healthcare workers, they're those people who work in the emergency sectors, like the armed forces. There are vaccines which they need to get, like hepatitis B, they need to get. For healthcare workers, we have talked about hepatitis B, there's cholera, there's typhoid, quite a number. Now, for the pregnant women, they're also supposed to get vaccines. Now, we normally give them tetanus vaccine, which is very important because we want to prevent them from getting, the babies from actually getting baby tetanus, which normally affects the nerves. And when it affects the nerves, the babies don't grow. They have painful muscles, it affects the jaws, it affects the breathing system. And so they normally get, if it's the first pregnancy, they will get 2 doses of tetanus injection. That is from 16-20 weeks. So we'll get the first jab of tetanus, then after 1 month, they get a second dose of tetanus. Then every subsequent pregnancy, they'll be getting tetanus.
This applies to immunocompromised expectant mothers as
Every
well?
pregnant woman should get tetanus vaccine. Remember, this is a toxoid vaccine. Now, this is not an active vaccine. It's more of an inactive vaccine. So every woman who is pregnant is supposed to get a tetanus vaccine.
Right.
The other thing is the influenza. Yeah. It's very important for them to also get a flu shot because they are actually prone to getting a lot of flus and respiratory problems. Yeah, so if they can get a flu shot, that would also be recommended.
There's a doctor here who is saying, a pediatrician who is saying, but live vaccines administered to an expectant woman may pose a theoretical risk to the fetus, Dr.
That's true. That's true. We don't give live vaccination to pregnant mothers.
Okay, and she had elaborated on
maybe
what
if I can just add,
yes,
unless the risk outweighs, if a mother has rubella, for example, she might need to get a rubella vaccine eventually because the rubella itself will compromise the baby. So unless the risk outweighs, but otherwise live vaccines, we don't give them.
Yeah, somebody's asking here, Dr. Infection with HIV, is that a contraindication to vaccination, including BCG and measles, for the babies, for the mother?
No, it's not. It's not. It's definitely HIV is an immune, compromising condition. But those vaccines are given to children with HIV.
Children with
definitely.
HIV. Okay. All asymptomatic HIV-infected children are able to receive BCG at birth. Caroline, just to confirm that for our viewer, are HIV-infected children, or those that are immunocompromised, perhaps those that might have cancer, can those be administered? Can the BCG be administered at birth to those?
Absolutely, it can. The only contraindication we said, if the disease is active, that means that the baby is sick at that particular moment. Then the live vaccines will have to hold them. But as long as the baby is okay, we give all the vaccines.
Okay.
Yes.
All right, and I'll take your parting shots, lady and gentlemen, as we finish, as we talk about immunization and how important this as regards public health and as regards awareness. Dr. your parting shots as we close this morning.
Yeah, but I'll encourage every parent to take their children for vaccination. Vaccinations are important, they are safe, they prevent your child from getting very serious diseases and conditions. If you have the opportunity to do, if you can do the whole, the comprehensive vaccination, schedule, please go ahead and do that. If you can't do what the government is providing, they're all the same. They provide, they save your children from getting infections.
Yeah. Caroline, as we close?
Yes, so I would just want to say and echo what Dr. Ria said, that let's take our children for vaccination. The side effects might be there, but it is not an indication not to take your babies for the vaccination. And there are seasonal vaccinations which are very important, like the meningitis vaccine, the flu vaccine, typhoid vaccines. They are quite available. And if you look at them, they're not as expensive as you would think. So if we can be able to afford them, then why not? I mean, we can give our babies these vaccines. There's also rotavirus, which I forgot to mention, which you normally give from 6 weeks. Yeah, so it's given at 6 weeks, at 10 weeks, and 14 weeks. We have different types of rotavirus vaccines. We will have what we call Rotarix and Rotatec. Rotatec is given 3 times, Rotarix is given twice. Yeah, so as long as we're going to prevent our babies from dying from the first year, the 5 years, I mean, that's something we need to look into and take our babies to be vaccinated. Okay,
and so I've just gotten a reaction on the fly. My child got immunized with the rotavirus vaccine, but still has gotten rotavirus. So Dr. here says that some of these vaccines don't necessarily mean you will not get that disease or that condition. It just means that it will suppress the symptoms.
Yes, it won't be as severe, and the body will be prepared. Yeah, so once you get the disease, the body is already prepared. There's memory cells that have already been created.
Very insightful conversation. Many thanks. I was joined this morning by Dr. Abdirahman Farah. He's a consultant pediatrician. And I was also joined by Caroline Mololo. She's a nurse and a midwife, technical officer, Midwife Association of Kenya. Many thanks for joining. Continue sending in your feedback. Our SMS number is 22422. Hashtag is Daybreak. My name is Lillian Muli. Enjoy the rest of your viewing.